For thousands of years, those suffering from a mental illness were ignored. Society chose to turn a blind eye until the 18th and 19th centuries. Mental hospitals were born and patients were treated morally and right until the population of the United States began growing by the thousands due to immigration. Dorothea Dix, advocate for mental health, began a long series of reforms in order to better the mental health system in the United States. This series continues today, as new treatments and medications are being discovered every day. In a quickly evolving society, Dorothea Dix was able to take a stand against negative conditions in the world of mental health. However, it took over a century for long-lasting reforms to take place. In the founding of the United States, the 10th Amendment to the Constitution gave individual states the powers not delegated to the United States by the Constitution. This gave the responsibility for health and welfare to the state governments rather than the national government. The first push for mental health reform came in the 19th century, which was part of the general reform movement aiming to better the condition of less fortunate members of society. Evangelical Protestants created the belief that human beings could be perfected by changing their social and physical environment. Before the year 1800, insanity was not defined in medical terms and was not identified as a pressing social problem. In the 1700s, people suffering from mental illnesses were generally cared for with private charity or existing poor laws. Without any institutions to care for the mentally ill, there is no evidence to suggest the fate of the insane was any different from other dependent groups. By the 1820s and 1830s, the mental hospital became prevalent in society. Society aimed to prevent any individual from standing out and tried to create a culture where everyone conformed to the accepted societal norm. These hospitals believed that moral treatment would help those suffering from illnesses. This treatment was based on the belief that the insane could be cured by being segregated into small pastoral asylums where they could receive humane care and instruction. Moral treatment called for warm, familial atmosphere, medical treatment, occupational therapy, religious exercises, and absolutely no violence. The Hartford Retreat in Connecticut adopted this, along with the Friends Asylum in Pennsylvania, and more than 90% of patients had success. When the population increased due to immigration, asylums became large and more custodial. With more patients, there was less resources to treat the people. Therapeutic practices were soon undermined and cure rates began dropping. Additionally, people had unrealistic expectations of treatment, and with every reform movement, there was a period of success. However, it faltered as soon as the circumstances changed. People of the time expected miracles and had no appreciation for the practical limits of the time. The treatments available were only useful for acute or mild forms, and generally did nothing to help those suffering from chronic illness. Once it was determined treatments were not working, people were considered to be incurable. As a result, people accumulated in acute treatment centers, and the public resisted allocating resources as each state legislator was responsible for creating funds to keep the mental hospitals running. The disappointment over the inability to cure patients and meet expectations of a cleansed society created a negative stigma for the mentally ill, especially those with chronic illness.
In the 1800s, no one was really paying attention to the care of the mentally ill. It would take one person that cared enough to begin change and start a mental health care revolution. That person was Dorothea Dix. Dix was born in 1802, which was a time when mental health care was more to get the sick out of the eye of the public instead of helping them with their ailments. Before she moved in with her wealthy grandmother at the age of 12, Dix lived with her alcoholic and abusive parents. Her grandmother was able to educate her, and Dix was then able to teach poor and neglected children, write books for children, and open a model school for girls. However, in 1836, Dix had to shut down her school. Throughout her life, Dix suffered from poor health, which based on her writings seemed to be depression, and in 1836 she suffered from a fit. In hopes of a cure or help, she traveled to England. There she met the Rathbone family, who were Quakers and social reformers. They invited Dix to stay with them at their mansion in Liverpool. While staying with this family, Dix was surrounded by people who believed the government should have a direct role in social welfare. This introduced Dix to a lunacy reform, which was a movement for the mentally ill's care in Great Britain. The people involved in this reform would write reports of their investigations on the asylums and madhouses and publish them to the House of Commons. Inspired by this movement, when Dix returned to the United States in 1840, she conducted a similar investigation into the health care of mentally ill in Massachusetts. She learned that most towns contracted with individuals to take care of the sick. It was unregulated and underfunded, which led to the abuse of mentally ill. In response to Dix's lobbying, the state passed a bill to expand the state's mental hospital in Worcester. Dix then went to more states, conducted similar investigations, published her findings, and was able to get more states to either expand or create mental health hospitals. Dix also tried to get a bill passed federally called the Bill for Benefit of Indigent Insane, which would set aside 12,225,000 acres of federal land, 10 million acres for the insane, and the remainder for the benefit of the blind, deaf, and dumb. The proceeds would be distributed to the states to build and maintain the asylums. This bill passed in both houses but was vetoed by President Pierce. Although Dix was unable to achieve her goal of federal government funding for the mentally ill, she was important to history in several different ways. Her investigations were unprecedented in the United States, making her one of the first investigative journalists. Also, Dix was able to gain fame and influence despite being an unmarried woman from an unstable upbringing. Lastly, Dix was able to bring attention to this issue of mental health care and played a significant role on how mentally ill are treated today.
Dorothea Dix was able to create a small revolution of change in her time in regards to the treatment of mental health patients due to the numerous legislative changes spanning across the United States from cases she took to court and general public appeals. After Dix's death, the mentally ill became increasingly more likely to be found in a hospital receiving treatment rather than a jail. Because of this, more hospitals for the mentally ill began to pop up across the country, and many functioning hospitals began to undergo renovations to make them more suitable for their patients. Unfortunately, because mental institutions were funded by the public and received little government aid, many hospitals could not complete renovations and were forced to shut down due to finances. Halfway homes, which were community-based, also began to rise in popularity during this time. These also suffered the financial hardships from lack of funding. For several decades, this was the standard of mental health care because few areas could provide better. In the 1920s and 30s, the United States took a more negative turn in regards to their mental health treatments due to the rise of the eugenics movement. This movement allowed states to forcibly sterilize members of the population who were seen as having undesirable traits. The mentally ill were often victim of this movement because people believed that if the patients could not pass down their traits, they would no longer be in the gene pool and the United States would be rid of mental illness. The eugenics trend came to a halt in the late 1930s and early 1940s as a result of the rise of Hitler. The mental health industry began to improve after the eugenics movement, but still did not receive the funding it needed to provide the best treatments for its patients. A court case in 1973, Solder v. Brennan, further defunded the few remaining mental institutions by declaring that the patients in mental housing facilities could not perform unpaid labor. Many institutions could not afford to pay workers, so were forced to close. During this time, however, more people began to advocate for mental health rights, as Dorothea Dix once had. First Lady Rosalind Carter, a mental health advocate, was able to push through more legislative changes and provide government grants for mental health facilities through her husband. Treatment for patients as well as quality of treatment began to rise as a result of the recognition of the necessity to treat veterans. Reforms for both mental health treatment and the rights of patients began to spread across the country, and the quality of treatment for the mentally ill began to rise to the highest it has ever been in this country. Today, treatment of mental health is stronger than it has ever been. There are numerous laws in place that grant mental health patients rights regarding consent, treatment, decision-making, and guardianship. Mental health treatment is still not perfect, however, and many patients still experience social stigma. And although there are medications for many illnesses, there are few perfected treatment options. Although Dorothea Dix did not cause immediate change in mental health, the improvements made because of her advocacy paved the way for the improvements in the industry throughout the 20th and 21st century.